The fellowship program is in the field of hospice and palliative medicine, where the fellows get a very comprehensive education in this specialty. We have our core rotations, which are as required by the ACGME. This includes our inpatient palliative service at St. Luke's Medical Center and Sinai Hospital, inpatient hospice experience at our inpatient hospice unit, Zilber Family Hospice, exposure to geriatrics and continuity care in our embedded clinic at the Vince Lombardi Cancer Clinic, electives, basically everything that someone would need to become a well-rounded and successful palliative physician.
In 1 year, we get the chance to go to 3 different main sites, which includes Zilber Family Hospice, St. Luke's, and Aurora Sinai. I like it because each place is different, so you get to work with different providers, different styles, and different kind of patients too.
The other thing we get to do is go on home hospice visits, which is, it adds a whole different dimension to care when you're going into a patient's house and you are actually with them in their own surroundings. It really opens your eyes to the struggles that patients have in real life. If you see a patient in clinic or the hospital, you're in control. But when you go to somebody else's house, they're the ones in control, and you also get to see how they live. What are the other factors that are impacting their care?
I think one unique experience for our fellows is that we're one of the fewer programs that have our own freestanding hospice facility. We're very proud to call Zilber one of our own, an Aurora Zilber home. It's very popular and well known in Wisconsin for being the Cadillac of hospice facilities. We have top-notch providers, nurses over there, and working there prepares you for your actual role as a hospice medical director once you finish training over there.
I think Zilber is special, one, because it was built to be a hospice. A lot of other inpatient units exist within a hospital, within a nursing home. This place was thoughtfully created to be a hospice facility. So I think we have a unique opportunity to, one, really spend time with patients and families that may not be available in another setting. But two, I think we have a unique opportunity to teach people because we are here and we can see patients in real time as they are progressing through their disease trajectory, and we can teach people that, and I think it helps mold a physician to know in real time what that looks like.
So a very important aspect of our fellowship is the well-being of our fellows and their emotional state. We do have mentorship programs. We also have chaplain. Sometimes it's a chaplain, sometimes a social worker that is also paired with the fellows to kind of just walk through and kind of do regular checkups just to make sure that everything is fine.
A big part of what I do is not only provide them support, but also provide them some of the same training that goes into developing chaplains. Specifically, one of my other roles is a chaplain educator. So I bring some of that knowledge and that experience into teachable moments where we reflect with the fellows on specific case studies, case examples, and look at the psychological, the emotional, the spiritual dimensions of the people that they're encountering. Not only their patients, their families, but even they themselves.
One of the things that I noticed as a fellow, and that I continue to notice now and I try to be a part of, is that all of our attendings, all of our faculty and staff, they really love teaching. It's not just, they come in and they do their normal jobs and, oh yeah, there's learners with them. They really go out of their way to make sure that our learners, our fellows, or residents that rotate through the program are really making the most of their time and developing into very well-rounded, physicians.
It's a real joy to watch the development and growth over the course of a year. And initially, it's exhausting for all the fellows that I've gotten to work with, and at the end, it's extremely rewarding. And so, seeing the ways that they take their education seriously and integrate all the different things that they're learning constantly. It's amazing how well prepared they are at the end of the program to go out and be so many different places because of all of the different high level of intense training and support that they get. It's not just the education, it's also the support that kind of collaborates with that process.
I think our team is unique. I have spent time in a lot of different places, and I think this team over time has really grown to be like family to each other, and we care about each other, and we care about providing a good educational experience to people as they matriculate through with us.